Welcome back to the Morning Blend, everybody, from Gulfstream Urology. Dr. Alejandro Miranda Sousa, good to have you here. Welcome back.
Thank you, Bill.
Subject that is very important this morning. We're talking about the kidneys and kidney cancer.
Okay.
I'll let you start where you want to start.
Absolutely. So first, the kidneys are two, and the kidneys are located in the back of the abdomen, on each side of the spine. They're nicely protected. And the main function of the kidneys is to filter the blood, to make the urine and get rid of some byproducts and toxins of your body. So this is a system of filters, and these cells in the filters are where the kidney cancer comes from. And they're just cells that become abnormally, in a sense that they grow without any stop. Nowadays, kidney cancer is not extremely common, but it is common enough that is routinely catched on imaging studies that are done for some other reasons. So thank God it's most of the time caught on an earlier stage.
You've given me, and I want you to share them with everybody out there, some risks for kidney cancer. Smoking.
Smoking,
if you
very
smoke
important.
cigarettes,
you increase the risk of exposure to some chemicals, and smoking enough will be an increased risk for developing kidney cancer. That is true. Obesity is another one. African American is another one. Exposure to some chemicals. Family history is important. Hereditary conditions can cause that, and also if you have a relative, especially siblings, could be more at risk of developing kidney cancer.
And for a man?
Man too. Man will be, much more common, close to double than females. Thank God the kidney cancer is discovered after age 40 most of the time. So earlier, younger than 40, not very common cancer to have. And the other one is important is chronic kidney disease. Patients having dialysis, the risk increase too. So there are some also medications that could cause this in conditions. Sometimes the medication itself or the condition itself, like hypertension, could be related to that. We don't know for sure what is the reason, but we know that it could turn on or off some genes that could affect and have the risk of developing cancer to increase.
Let's take a look at some pictures that you brought that help illustrate the points you're making. Right here we have the kidneys.
Yeah, so the kidneys are two, and you can see on the left how the kidney orientation is. On the right, you can see the kidneys divided and cut. You can see the blood vessels, and then the ureters and the bladder. Just an idea of location on each side of the spine. In the next picture, you'll be able to see how a normal kidney looks on the left, and a kidney with a tumor will look on the right. And sometimes it could be like that, big and growing outside of the kidney, you can see on the surface, and sometimes it could be very exophytic, growing outside, or pretty much inside the meat of the kidney you cannot really see, and varies on sizes. This one you see is a much bigger one.
It is.
And you
it's
can
almost
see
the whole, half the size of the kidney.
Absolutely. Sometimes could replace a whole kidney. Sometimes could be very small, but you can see how it's growing into the yellow gland that on top of the kidney is an adrenal gland, and that will be also for staging purposes. We have another picture here. So very important for kidney cancer is imaging studies. Imaging studies are key to be able to diagnose this. In this case, we have a CT scan, and you can see how the kidneys are bright, and you can see how there's some brightness inside that darker area in the kidney that is very suspicious for cancer there. So CT is a very important tool. You can see here, a CT scan also, you see three phases. The one on the left has no contrast. The one on the middle has early contrast. You can see how the tumor or the round circle is much more clearly visible and how it enhances and captures contrast. And the last one is delayed film. You can see that those variations are key for diagnosis. And our image studies showing a tumor, in this case on the right kidney. And there is one, and the next one shows pretty much the whole kidney is replaced by a cancer. You see normal kidney on the left of the screen, and on the right of the screen you see pretty much a tumor taking over the whole kidney.
Would I know if I had kidney cancer?
Usually kidney cancer will have no symptoms. We want to catch that at that stage. When they have symptoms, usually is when the disease is very advanced. So very important to feel for lumps or bumps, blood in the urine, malaise, weight loss, and you need to visit your primary care physician often, and that will help you and protect you.
And treatments available are?
Most of the time, surgery will be with a curative intent with a higher chance of success if it's catched at an earlier stage and a smaller size. Nowadays, there are some immunotherapy that could be used, and now there are targeted therapies, areas of the tumor that could grow fast, or blood vessels to the tumor that could be affected. And there are some new ways of treating cancer that we didn't have a few years ago. Radiation is not as effective and could be treated for advanced disease. So ideally, we need to catch it early to have a big chance of success.
Thank you for all that great information, saving lives. We appreciate that. If you need to know more about all this, you can contact Dr. Alejandro Miranda Sousa at 21st Century Oncology or Gulfstream Urology right there. And you can get more information by going to our website, which is fox4morningblend.com.
All right, one last check in our Fox forecast, and we'll be right back.